Hey guys, welcome back to the Becoming Anchored podcast. So glad you're here with us today. We're super excited about this episode and the content we have and just having a conversation with y'all. So I'm Lauren Jackson. I'm one of the hosts here. Laura Deneen is our other wonderful host. We are two licensed therapists in the Brentwood, Tennessee area. We're part of a group private practice called Anchored Counseling Company. At Anchored, we see and treat anyone presenting with eating disorder, disordered eating, all the way to grief and loss, anxiety, depression, OCD, life transition. We kind of see all ages through the lifespan. We love what we do. This podcast has been so life-giving for us just to engage all in a different way and to share, our lives and our kind of therapy knowledge with you all. So quick disclaimer before we kind of jump in and get started with this content. This podcast is for informational purposes only. We're not intending to be your therapist or do therapy with you over this platform. So if you're listening, if you feel like you might benefit from therapy and you're local to us, reach out to us. We'd love to connect. We'd love to get you scheduled and start that process with you. If you're not local to us, find someone in your area who is licensed.
Thank you, Lauren. Like Lauren said, this has just been such a fulfilling journey for us. And I feel like that's the word that we use for every introduction to the Becoming Anchored podcast, but it truly has been so fun for us and such a sweet time of connection for the two of us and just really a fun space for us to talk about all things like life and therapy. And we love being therapists. We love sharing some of our wisdom on the show. And my hope is that you all will also get to know us and some of the things that we've been through, the hardships, the pain, the suffering, and moments of joy as well. So that's really the purpose of the Becoming Anchored podcast, is to show up first and foremost as humans with you all, and then to also share some of our therapeutic wisdom that we have gleaned over the years. So welcome. We've got a fun and exciting episode for you all today. I'm super excited about this topic, so let's go ahead and jump right in. Today, we are going to be talking about what to expect if you are new to therapy. And Lauren and I were chatting briefly before we started this episode. So this really is if you are a newcomer to mental health therapy altogether, or maybe you've taken a break and you're resuming therapy with a provider. We are going to share more specifically what to expect. And we're really going to be talking about how we approach new clients in our practice. So, of course, we can't guarantee how other providers are, providing care. But my hope is that whoever you're seeing, you feel comfortable and safe and challenged and encouraged and equipped and all the good things. So let's go ahead and dive right in.
Yes. So for those of you who've maybe never been to therapy before, it can certainly be a little bit of a scary step to take, for sure. And maybe you've thought about it. Maybe you've even done some research. Maybe you've looked up some people on Psychology Today or whatever, right? And so, just to validate, taking that first step and picking up the phone or sending the email can certainly feel overwhelming because maybe you don't know what to expect, right? You don't know what that first kind of session is going to be like. And maybe even there's a fear or an internalized kind of, fear that I'm going to have to sit down and just share my whole life story and all my deepest, darkest secrets with somebody that I don't know. And so to start out by saying there's never any pressure here in our space that you have to divulge everything about yourself and so your deepest, darkest secrets that we really value here at Anchored, building rapport and creating safety with our clients. And safety can mean different things for different people. And so each of the different therapists here really are super mindful of how to build that safety with each client and how that client needs it. So
yeah. And Lauren can speak to this just so well because she actually at this point is answering phones and getting new clients established with the hopefully the best fit possible for them. And so she is really on the front lines of placing clients and talking to new clients about their concerns, answering questions about our practice. And Lauren is so patient and warm and thoughtful. And I think that new clients certainly feel that from her. And just to echo what you're talking about, I mean, good therapy is paced. And so what I mean by that is, when you're with a therapist that knows how to pace you and the session, that typically is going to go better for new clients, right? Because it's not that we don't want to know all your deepest, darkest secrets. It's that we also understand the way the nervous system works, what we call the window of tolerance, which we've talked about that quite often on the show. It's essentially where we're able to stay regulated the best. And so, as we move through therapy, the goal is to help you practice being more vulnerable. But in the first few sessions, we want to build what's called rapport and safety first and foremost, so that you know that what you share is appropriate and is okay to be shared with your therapist. And so I do think pacing is really important, and it allows the client to feel cared for, to know that they can trust their therapist and that there is safety there. So that's certainly something that we are training our staff on as well. And Lauren, trains the staff. And so she does such a great job with that. But in the first session, I mean, your therapist is hopefully reviewing their practice policies. So that's essentially their cancellation policy, what we call informed consent. They're reviewing limits to confidentiality. Here in the state of Tennessee, we are mandated reporters. So, any suspected, abuse of any kind, that includes child or elder abuse. They're also reviewing any kind of benefits and risks that they might want to speak to in the therapeutic room. So that's really this first few minutes after you, meet your therapist and say hi to your therapist and walk back into your therapist's office. That's what they are going to be doing in the first few minutes of session. And then Lauren can kind of speak to what the rest of session might look like.
Yeah. So, in that first session and maybe the first couple of sessions, your therapist is really asking a lot of questions and kind of assessing for whatever it is that maybe is bringing you into therapy, or whatever it is that kind of prompted you to pick up the phone and call, or, send the email, or submit the form on the website. So a couple of different ways you can reach out to us. There's a form you can submit on our website. You can give us a call. You can shoot us an email. So a couple of different ways. And then we train our staff to be as prepared on the front end going into that first session as possible. So we ask all of our new clients to fill out intake paperwork before they come in, and it's through our kind of electronic system. So the therapist can get that intake paperwork even before the session starts and have a little bit more insight into, again, what is bringing you in the door. And so, your therapist is going to be asking what we call assessment questions, but essentially just like wanting to get to know you and your story and what parts of your story you feel safe sharing in that first session. And really, like, what is showing up for you, like right now in the present that does feel like it's getting in the way. Your anxiety, maybe your depression, your OCD, your relationship conflict, interpersonal relationship concerns, I don't know, body image concerns, whatever it is that's bringing you in. Your therapist is just wanting to know more about it and how it's getting in the way in kind of your present life. Your therapist might ask you some questions about your family of origin. So like what we might call like a biopsychosocial kind of assessment, if you will, a fancy word for it. So what was it like growing up in your family of origin? What was it like for you socially in your friend groups? Where did you grow up? What was it like for you? That kind of thing. So that's really like the first session. And then of course you guys are setting goals. Y'all are talking about like, okay, what are the 3, 4, whatever kind of main things that really want to be addressed and worked on, because those goals are going to be such a helpful framework and map for the treatment plan. And the treatment plan is kind of what your therapist is mentally creating. Maybe some therapists write it out too, but like kind of creating just in terms of, like I said, that treatment plan moving forward. It helps give us structure It helps give us some guidelines. It helps us know the direction we're going in the therapeutic process.
Yeah.
So goals come up in that first session, the first few sessions, as you're kind of honing it on what the work is going to look like.
Yeah. Yeah. Absolutely. Yeah. And it's meant to be hopefully collaborative. And so, as we have progressed over the years, yes, your therapist hopefully is professional and an expert in what you are seeking support around. And we certainly want it to feel collaborative, like you are always aware of what is happening in the therapeutic space. I'm a big proponent of sharing when I provide a therapeutic intervention. I will certainly say to clients like, hey, this is actually from acceptance commitment therapy. And, this therapy, we really talk about separating from our thoughts, right? So I will name what I am doing as I am doing the intervention. And I think that certainly helps build safety and is collaborative in nature. And then at the end of the first session, one thing that I'm doing too, and I know that you do this as well, Lauren, is I'm asking clients if they have any questions for me about the way that I practice or for me as a person, right? So I feel like my clients know me well. And one of my values, if you've listened to the show, is authenticity and transparency. And so they do know that I'm married to Sean and that I have a daughter, Marianne, and, a dog named Louie who can be kind of wild at times. And so that I think it's appropriate, but it does allow them to feel that there's some sense of like, okay, I know my therapist and I know who she is. And again, it's within appropriate boundaries and context, but I will certainly ask that at the end of session. I'll maybe ask like, how did this feel to you? Where was your anxiety walking in compared to the end of session? And most of the time the anxiety does go down, right? Which is a cool exposure if you think about it. But yeah, I'm certainly asking all of those sessions, is there anything that you feel hasn't worked in your prior therapy experiences or anything that you didn't like about, previous therapists, anything that was said or done that you just didn't love? And that's important for me to know too, just to keep an eye out for that in my own treatment plan, like Lauren's talking about. So those are just additional things in the first session or two that I'm checking in on with clients.
Yeah, something else that you will find here, or our clients find here with us, kind of across the board, is we really train our therapists on creating a sense of continuity between from session to session. Not that we as therapists aren't mindful of the different topics that may come up in different sessions, but maintaining a sense of, like I said, consistency or having a kind of a thread that helps bring past sessions and the process of past sessions or the content of past sessions along the ride or along the journey. And then we also train our therapists in giving homework. And so if you're a client here, if you're a client in their practice and you're listening, you're like, yep, I get homework after every session. Good. You should be getting homework. And that could be anything. And we say homework because that's like just the word that, makes the most sense. But I mean, it can be anything from like, hey, here's this thought to take with you. Here's this journal prompt to take with you. Here's this worksheet. I'm going to email you a worksheet. Go read this book, listen to this podcast. I will give homework to like, go ask your partner how they're feeling. And then they ask you how you're feeling.
Amazing. I'm like, what is this homework that you're giving? I want to take it.
So we just feel that kind of continuity piece helps our clients feel seen, helps our clients feel like we are tracking with them. And then the homework piece helps our clients feel like they're getting value from our time and they're able to take that value with them into their real life in between sessions. And so that just feels really important to us. So that's something that you can expect. I mean, my clients get that from me from session one. So from the very get-go, they get that from me and from all of us here. And so that maybe is something perhaps unique in some ways to Anchored, maybe not, but that's a consistent thing that we try and really bring into the therapeutic process here for all of our therapists. And that's not to say as well that we all have different kind of styles, right? We all have different, maybe a little bit of a different way of like showing up and being with our clients and maybe some of our therapeutic style leans more towards different types of like modalities or interventions. Actually, Laura and I were talking about this the other day. Laura, I think you were mentioning like how maybe with like body image work, you tend to be more behavioral, like intervention heavy, and maybe I'm a little bit less behavioral intervention heavy, and neither one is wrong or right. It's just our kind of different styles, if you will. So we all have different styles, and we try here at Anchor to really foster those different kind of styles of showing up therapeutically, as well as maintaining the consistency of like, you're going to get homework. There's going to be consistency or continuity between sessions. There are going to be goals. There's going to be a treatment plan. You're going to be assessed well. You're going to be given the right appropriate recommendations. You're going to be encouraged to be seen frequently. You're going to be followed up with all of those things.
Yeah. Well, and again, we really want any client that walks through our doors to feel held, right? Mm-hmm. We know that this world can be cruel and harsh, and we want Anchor to be a safe space to land. Now, that's not to say that we're not going to challenge you or push you or like be with you as you work through your trauma or, anything hard that's been through your life. But we really want it to be this like warm, safe spot to land. And so all of these things that Lauren is talking about is a part of the way that we practice.
Yes.
And just to kind of elaborate on what you shared with the homework piece, sessions are typically 50 minutes long. And so we know that a lot of life is happening outside of the hour that we get, the 50-minute clinical hour that we get with clients. And so the purpose of the homework is to really foster and cultivate this idea of doing the therapeutic work outside of therapy and noticing what comes up in your everyday life. And really, we know that a lot of change is even happening outside of our offices. And so that's one of the reasons that we give homework, is because we understand that a lot of life is happening in between sessions and we want to know about it. So that's the benefit of like a journal prompt or tracking behaviors or, spending time at the end of every day thinking about something hard that happened that day that you want to talk to your therapist about. It's really helpful for our work in that 50-minute clinical session, just to really support clients in meeting those goals. And an effective therapy, good therapy, is hopefully your therapist is consistently returning back to the goals. Like, hey, we had this goal around, maybe you were trying to challenge yourself to eat pizza. How do you feel like that's going? Are we making progress towards your goals? Because we want all of our clients to lead fulfilling, wonderful, prosperous lives outside of here. And we want our clients to get better, whatever that means for them in the context of their own stories. And so I have stayed in therapy over the years, and it's really helpful to me and for me. I think it helps me it helps me process, right, my different roles and the different responsibilities. And I really love having a third party. And I've also tracked towards my goals, right? And I am continually, being asked by my therapist that I've seen, over the years. I've had the privilege of working with a couple different therapists here in Nashville, like what progress I'm making towards the goals. And, is there anything that we're not talking about that maybe I want to be talking about? That's another helpful question that your therapist hopefully will be asking you as you get to know them and as they get to know you as well. But yeah, that's really the benefit of homework. And even that skill of immediacy that you talked about, right? Like tuning into like, hey, how are you feeling in this moment about what we're talking about, what we're doing? Do you feel like this is helping you? How do you feel about our sessions as a whole? That can be another piece too that's helpful.
Yeah. We really value that immediacy, or being kind of, embodied with our clients, present with our clients, attuning to our clients in that moment. And so, we train our therapists pretty extensively on using immediacy, being embodied. You can expect that with us here. So that attunement piece is being able to, kind of read body language, read facial expressions, kind of read the room without maybe you as the client necessarily saying anything, but the therapist being like, something's going on. What's going on right now? Right. And so we really just value that as a really rich part of the therapeutic process. And so as you were talking about homework, Laura, I tell my clients that like 5% of their work happens in the therapy session, and then like 95% of their work happens outside, because you're outside of the therapy office significantly more than you are inside the office. And so again, that's one of the benefits or pieces of homework that can be helpful, is facilitating that 95% of the work you're doing outside of the therapy room. So
Yeah. Yeah. And when Lauren's talking about being embodied, there's all sorts of ways that we can do this as clinicians. I like to poke fun at myself, and that's certainly a way to do it. Laughing with clients, attuning to body language, checking in about, their body language or maybe their facial expression. Those are all skills that I think are important for your therapist to have, whether you see someone here or maybe, you're in a different part of the country and you see a different therapist. But those are all things that I think really contribute to the therapeutic process and can really support you in feeling like you are seen and heard and understood, because at the end of the day, that's what makes therapy helpful, right? So we heal in our relationships with others. We can also be heard by others, but for the sake of this conversation, effective therapy allows us to heal in a safe place. And we heal because of the relational nature of therapy. So, we as therapists, we are relationship builders first and foremost. And so that's really the most important piece in our minds. And I think I can speak for Lauren when I say this, around really those first few sessions and what to expect is your therapist is inviting you into a safe relationship with them, where we can explore all the moving pieces of your story, what is working, what isn't working, maybe your trauma history, all of it in this relational piece. And so as a practice, we really just first and foremost want to build relationships with our clients. And of course, as we go along, we might challenge more, we might get more feedback. As we get to know clients, we might maybe even call them out, right? Once we get to know them. But as far as the first few sessions go, we are really inviting our clients into our relationship with us. And I know that I adore this work, and I know you do too. So it's just such a privilege whenever anyone shares their story with us. And that's really what we're walking into session with, is like, wow, what a privilege it is to sit with you and hear about your pain, right? Most of the time when people start therapy, they're in a lot of pain. And maybe you haven't ever shared that.
Yeah. And I think, and I know this for myself personally, because I've experienced it. And then I know this for my clients because I've seen it. I think one of the most healing things for our pain, past or present, is for that pain to be bear witnessed to. So when somebody bears witness to your pain, I think that's where healing happens. And so that, like Laura said, that's what we're inviting you into, is to say, hey, I will see your pain. I will sit with you in your pain. I will feel with you in your pain. And then it's like the healing can happen in that safe place. And so that bearing witness to just feels really important. And I think ultimately here at Anchored, that's what we want to do well. And so all of the things that we've talked about, in this episode of like, what can you expect as a new client? All of that, all of what what we've discussed is to really foster that like safety for your pain to be here.
Yeah. And I know that Lauren and I have both benefited greatly from our own therapeutic experiences. And, we just feel such gratitude for them and their roles in our lives, the various clinicians that we've seen over the years. And so we are big believers in therapy and the therapeutic process as a whole. And of course, there's other things that we do, as far as what to expect. I mean, we have water and tea and coffee and snacks. We love our snacks here. And we are constantly restocking those. But yeah, we try to provide, kind of a home away from home, if you will, if your home is safe for you, of course. But those are just some details that we are trying to provide for clients so that they feel safe. And hopefully, sometimes I know that you might not look forward to coming to therapy. Sometimes you might. So wherever you are on that spectrum, we welcome you. Even if you're dreading session, I certainly have had times when I'm like, I go today, but then I go and I'm glad that I went. Take something away from it. So that's our hope for every client. Thanks for being here, you guys, for this episode. We hope this has been helpful for you all as far as just expanding upon what to expect if you're new to therapy, or maybe you've taken a break from therapy. Your homework, I will give the homework and then Lauren can provide the affirmation. But your homework, if maybe you are new to the therapeutic process, is to journal about your fears of starting therapy. There's a lot of value in really naming the fear. And there's a lot of research around this that it actually a lot of times allows the fear to go down. And so to write out your fears, and my challenge to you, if you've been on the fence about starting therapy, is to consider starting and to consider sending that email or picking up the phone and scheduling a session. If you're in the state of Tennessee, we would love to see you. And if not, we encourage you to reach out to someone local to you. And then Lauren will close with our affirmation.
Yeah. The words that were just coming to mind are kind of piggybacking off of what I was just saying a second ago, that your pain or your story or whatever maybe trauma is from your story. And maybe those of you who've not done therapy before, it's been a while since you've done therapy. All of that is not too much. It's not too big for the therapy room. I mean, hopefully it's not too big or too much for anybody, but it's especially not too much or too big for us and these rooms that hold all of these stories.
Thanks for being here. This was just such a fun topic to talk about today.
Yeah.
We're so glad that you all are with us on the Becoming Anchored podcast, and we will see you next time. Take care.
Bye, guys.